Your doctor has recommended that you undergo laser in situ keratomileusis, or Lasik laser surgery, to correct a vision problem. But what does that actually mean? The human eye is constructed like a camera, with a clear lens in the front and light-sensitive tissue at the rear. This tissue makes up the retina, which acts like photographic film. In an eye that has perfect vision, light rays passing through the pupil are focused by the lens to fall precisely at the center of the retina. There are many common problems that can affect the eye and prevent light rays from focusing properly on the retina. 3 of these problems, myopia or nearsightedness, hyperopia or farsightedness, and astigmatism, can often be corrected or reduced with the use of Lasik laser surgery. Myopia, or nearsightedness, occurs when the shape of the eye is too long or the curve of the cornea is too extreme. In this case, light rays are focused on a point in front of the retina instead of on the retina itself. Hyperopia, or farsightedness, occurs when the shape of the eye is too short. In this case, light rays are focused on a point behind the retina. Astigmatism occurs when the cornea is unevenly curved, causing light rays to fall off-center or not to focus properly at all. In either case, Lasik laser surgery can be used to flatten all or part of the cornea, allowing your doctor to cause the focal point of light entering the eye to fall more closely to the center of the surface of the retina. Lasik laser surgery is a relatively simple and non-intrusive procedure that is designed to reduce or eliminate the need for glasses or contact lenses. Lasik laser surgery generally does not have any effect on the patient's overall health, and there are no risks in choosing not to have the surgery.
LASIK is a surgical procedure intended to reduce a person's dependency on glasses or contact lenses. The term LASIK stands for laser-assisted in situ keratomileusis and is a procedure that permanently changes the shape of the cornea, which is the clear covering over the front of the eye. LASIK is an outpatient surgical procedure that usually requires about 15 minutes per eye. Before the procedure, you will be asked to lie on your back and remain still. Topical eye drops will be used to numb your eye, and the area around the eye will be washed and cleansed. You may also be given a sedative to help you relax. Your doctor will use an instrument called a lid speculum to hold your eyelid open, and then place a ring on your eye that creates suction on the cornea. You may feel pressure and experience dimming of your vision at this point in the surgery. Once the ring is firmly in place, your doctor will attach a special device called a microkeratome to the suction ring. Using the blade on the microkeratome, your doctor will create a corneal flap by cutting approximately the outermost 20% of your cornea and lifting it carefully to one side. After removing the suction ring and microkeratome, your doctor will use pulses from a computer-controlled excimer laser to reshape your cornea by vaporizing tiny portions of its interior. This part of the procedure usually takes less than 60 seconds. Your doctor will then replace the corneal flap into its original position and observe the eye for several minutes to ensure bonding. Because the cornea bonds so quickly, healing is rapid and the eye does not require stitches. After the procedure, your doctor will administer antibiotic drops and place a shield over your eye to prevent you from rubbing it or from putting pressure on it while you sleep. Since you will not be able to drive immediately following the procedure, you will need to make arrangements for a ride home.
The lens of the eye is mainly composed of water and proteins. As we age, these proteins may begin to clump together and cloud the lens. This clouding is called a cataract. Cataract surgery is the removal of the affected lens from the eye and the insertion of an artificial lens. Before your surgery, You will be given eye drops to dilate your pupil, and the area around your eye will be washed and cleansed. In many cases, you will have a local anesthetic injected around or behind your eye. You may also be offered a sedative to help you relax. Most cataract surgeries last less than 1 hour. The most common method used for removing cataracts is phacoemulsification. In this procedure, the surgeon looks through an operating microscope and makes 3 small incisions, less than 1 inch long, in or near the cornea. An opening is made through the capsule of the lens, and an ultrasound probe is used to break the cloudy lens into tiny fragments. These fragments are vacuumed out through the incisions. Then, an artificial intraocular lens is inserted. Intraocular lenses, made of plastic, silicone, or acrylic compounds, have no moving parts and last for the remainder of a person's life. Because the incisions are so small, stitches are generally not necessary. Vision often improves notably immediately after surgery. Another method for removing cataracts is called the extracapsular technique. In this procedure, the incision made near the cornea is large enough to remove the cataract in one piece. Again, an artificial lens is inserted to replace the natural lens. Recovery from this type of cataract surgery is usually slower. Because the incision is larger, this procedure does require stitches. However, the stitches rarely need to be removed. After the operation, a patch will usually be placed over your eye, and you will be observed for a short time to be sure there are no problems, such as bleeding. Cataract surgery is performed on an outpatient basis, and most patients go home the same day. Since exposure to bright light may initially be uncomfortable, you should not plan on driving immediately following the procedure. You will need to make arrangements beforehand for someone to take you home.